The whole point of Ki-67 is that it's a much cheaper biomarker than molecular tests. So Ki-67 has been described in the 1980s, and it's a proliferation marker, which means that tumors that have a high Ki-67, they proliferate higher and they tend to have a worse prognosis. But what's most interesting is if you measure Ki-67 twice, one before treatment and one time after like 2 to 4 weeks of treatment, and that value decreases, it means that the treatment you're giving to the patient is actually working. Just like measuring some person's blood pressure, you measure once, you give him some kind of drug, and then you measure again, and if it's dropping, then you know the drug is working. The same thing applies to the Ki-67 research. However, there's a lot of controversy in the literature and in the scientific community about this biomarker, and the criticism is that there's no standard way of measuring Ki-67. There's no preclinical standard protocols, there's no, not preclinical, sorry, pre-analytical. There's no standard way of scoring the slides. So what we did, with the help of Ventana, we used a standard antibody, the 30-9 antibody for Ki-67. We used a standard way of staining the slides, and we used a computer software to help us analyze the slides. And what we found out is that combining the human eye of the pathologist, given some requirements that we found out, if that sample meets those requirements, you can just scan them and the computer does all the work, and that's reproducible with at least 2 pathologists. That's what we did and proved. And if the pathologist doesn't think that specimen has the necessary requirements for the scanner, he or she will score that slide manually, the old-fashioned way. But we also standardize how to score manually. And that was concordant, that was reliable, that was reproducible, and that makes a cheaper biomarker ready for tests in a much broad sense in another clinical trial just to test that assumption. But we're very optimistic about the work we've done, and I think we and the community, scientific community, we're getting closer to a standard way of using this biomarker, and it will probably be part of the clinical setting in the next years or so.